solution prior performing certain procedures of surgical asepsis as prior to surgery or delivery of a baby. Prepare yourself for the scrub. Put on the proper surgical attire used in your facility. This prevents bringing outside organisms into the area. The scrub shirt should be tucked into the scrub pants or the scrub dress, fitted or tied at the waist so that loose garments do not come into contact with scrubbed hands and arms or with a sterile giant towel. Put on a cap or hood, shoe covers, and a mask. This is to cover common sources of contamination. Examine your hands and forearms for cuts or blemishes. Do not scrub if there are any open lesions or breaks in the skin integrity because they can contaminate surgical wounds. Any shade of nail polish, including clear, should not be worn. This is to avoid chips which may harbor microorganisms. Fingernails should be no longer than the tips of the fingers to prevent puncture in the glove.
So first, before proceeding to scrubbing, we must first perform a pre-wash. Washing of hands, which is single most important method to prevent cross-infection because skin is not sterile, we need to reduce the number of germs on the skin by carefully washing before surgery. So next, we're going to proceed a washing of our hands. So first, we're going to open the faucet and adjust the flow of the water. So next we're going to wet our hands, wrists, and forearms under the running water. So the water should flow from least contaminated to the most contaminated area.
Moisten your hands and arms, keeping your hands higher than your elbows, so that water will drain off your elbows, flowing from the cleanest area to the less clean area.
The next we're going to apply a sufficient plain a non-microbial bar or liquid soap on our hands. This is to obtain a good lather, and soap cleanses dirt and oil. So we will rub vigorously to form lather on the surface of our hands, then right palm of our left and left palm of our right for at least 10 to 15 seconds. So this motion helps remove microorganisms mechanically. So we will continue rubbing palm to palm and fingers interlace. So interlacing the fingers and thumb cleans the interdigital spaces. So next we're going to the back of the fingers to opposing fingers interlace. Next we will rotation rubbing of the right hand, clasps in the left palm and vice versa. Then we will rotation rubbing backwards and forwards of the tops of our fingers and thumb of the right hand in back and vice versa.
Remove a brush from this dispenser and clean under each fingernail and around each article with a nail cleaner included in the package.
Turn hands with a thorough rinse under the running water for another 10 to 15 seconds.
Rinse hands and arms thoroughly, passing them through the water in our direction only from the fingertips to the elbows. Do not move your arms back and forth through the water.
So for the third step, we have our scrubbing. So in scrubbing, it includes two types of method. First is the counted brush stroke method, and then the second is the time method. Before we start, we must ensure that our hands has no lesion present and all the neck accessories is contained. So first, for the counted brush stroke method, we must select a sterile brush or sponge, then apply a liquid cleanser if the brush or sponge is not impregnated with one. Next is we are gonna scrub the left hand 30 strokes and all skin surface 20 strokes using the anomatic pattern. So first we're gonna do it with the four surface of each finger thumb to the fifth finger. So using the brush part of the scrub, we are going to scrub in 30 strokes. So we must ensure that when we are doing the procedure, we are doing it 30 seconds each step. small finger to thumb using the sponge part of the scrub. Next, we're gonna do palmar surface of our hands, small fingers to thumb. Next is we're gonna do our wrist. Next is we're gonna do it in V above the elbow or in the arm 2 inches above the elbow. And then next is we're gonna repeat it on the right side. Then our result. And that's it for our counted brush stroke method. So for our time method, first is we're going to select a sterile brush or sponge and apply a liquid cleanser if the brush is not impregnated with one. The next is we're going to scrub the nails, fingers, hands, and wrists at your left arm for 1.5 minutes using the anatomic pattern of the scrub described above.
So what are the purposes of scrubbing? First, it lowers the total count of microorganisms on the hands and arms. Second, it removes dirt and oil from the skin, decreasing the ability of remaining microorganisms to multiply.
Next is we are going to repeat it for the right nail, finger, hand, and wrist. Next is we are going to scrub from the wrist 2 inches above the elbow, spending 1 minute each arm. And that's it for our time.
Rinse hands and arms as previously described, passing through the water in one direction from fingertips to elbow. Hands should be extended in front of you and kept at right of your waist. Pick up the sterile towel by one end and allow the towel to unfold. Place one hand under half of the towel, use that half to blot the opposite hand, start at the fingers and move gradually up the arm. Use the other half of the towel to blot the second arm dry. Again, start the fingers and move up the arm. Push the cuticles of your fingernails back with the towel as you dry your hands. avoid contamination, if a sterile towel is not available near the scrub sink, walk to the table where the towels are kept. If you must go through closed doors, back through allow your arms to drip. To prevent ragged cuticle edges, decreasing the chances of harboring bacteria.
Let us assume that the nurse has already finished scrubbing. This is done for infection control. Grasp gown firmly. Lift gown directly away from the sterile field to prevent accidental cross-contamination. Step back from the table and extend arm at level of upper chest. This is to prevent gown from touching unsterile objects. While keeping arm extended and elbow slightly flexed, locate the edge of the gown's neck. Hold the gown securely and unfold it gently by shaking, keeping in mind that armholes should face the wearer. Then slip the hands into armholes. This is to maintain sterility. The circulating nurse places each hand in the inner seam and pulls the gown over the wearer's shoulders, and then ties the back straps. To tie the belt of the gown, scrub nurse forwards and swings the end of the belt. The circulating nurse grabs the end of the belt and ties them at the back.
For the open technique, first is to pick up the glove at the back cuff. Second is to slip the gloves and pull it in the hands, leaving the cuff folded back. Next step is the gloved hand is inserted under cuff of the other glove. Next is to slip the gloves to the hand. When both hands are gloved, fold snugly to the wrist cuff of both gowns. For the close glove technique, first is to grasp the gloves, and your fingers must not go beyond the cuff. Next step is to turn the palm upwards of the hand while keeping it in the insides. Next is to hook right thumb under the cuff of the hands. Matching your thumb to the glove stamp, grasp securely. Stretch gloves over end of sleeve and begin to move your fingers into the open sleeve. Is to hold sleeve and gloves and pull them as a unit. Lastly, pick up the other glove and repeat procedures 3 to 8.